I know so many people taken 20 times ECG, 30 times ECG and treadmill and echo test, all these for many times, and they are telling they did angiogram or they are having stunt, and like this they are confused everywhere. I really don't know. But finally, I asked them, what is the symptom? Why do you think that it is related to heart? Then they tell me symptom pain here and current passing like that here and numbness here, sometimes giddiness rotating. And I used to tell them it is totally very common. Most of the people, these symptoms are 95% of the people, these symptoms are from cervical spondylitis or brachial neuralgia or disc bulge, disc protrusion, disc prolapse. These diseases only making these kind of symptoms mostly, but they don't believe that. They again going to take ECG. I don't know this. Even cardiologist told you it is nothing problem. Why do you want to take again and again and again? This is really showing that you are something you are imagining, illusion, hallucination, or mentally you are affected. Mentally you have phobia about the heart. You are thinking heart attack only will kill you. Is liver failure will not kill you. Kidney failure will not kill you. Even spinal cord, anything happens, we will not die, you think, or we will not be paralyzed. Like this, anything, every part of the body important. We cannot live without any part in the body. It's very hard to live. So don't have this kind of phobia. Please listen carefully. And today this video, I will teach you also exercise. I will teach you what are symptoms in the neck pain, and you have to listen carefully. And I get these type of patients. I ask them 12 symptoms which is most common for cervical spondylitis or brachial neuralgia, disc bulge or neck pain and frozen shoulder. These related symptoms I ask them. First, I tell you what all common symptoms for this. Neck pain, one side headache, migraine or headache, total headache, eye, jaw and teeth or ear pain, and pain in the hand radiating down, or numbness or current passing like that. Sometimes pain in the sternocleidomastoid trapezius, all the cervical muscles, and sometimes pain in the scapula, backside, this shoulder blade region, and that pain radiates to the front in the chest in the men, right or left, and breast in the female, and particularly this side they get pain. That is the reason they are getting confused. It is heart like that. If you left hand pain means immediately they feel that heart. So like this, some current passing like that. So these kind of symptoms and persistent symptoms for 1 year, 2 years, it is totally cervical spondylitis symptoms. So don't worry about that, and you have to know these symptoms are mostly cervical spondylitis, brachial neuralgia, or disc bulge symptoms, and even frozen shoulder symptoms like this. If it is left hand, they feel that heart attack. If you are lifting, here pain. If you are lifting like this, here pain in the shoulder. If you are taking it to the other hand, you are trying to catch your elbow, that time you have pain. That pain radiates to the here mid of the arm, and while you are sleeping on that side, pain here, pain all these area. So you decided it is heart problem. It is myth. You don't worry. This is frozen shoulder. You have to do exercise for this. And the next thing, I really very much confused. They tell all this. They taken all these tests, and finally I clinically diagnose and tell it is cervical spondylitis and frozen shoulder. I reason out. They believe it also. Finally, I tell only 7 days exercises are enough to cure this problem permanently. then they are very unhappy. Actually, they have to be happy, and they don't take exercises from me. I don't know why this. Really, you are not knowing this, and even I treat and get cure. Again, they are sad only. They are not very happy because again they have doubt it is heart problem like that. If someone knows what is this phobia called, please comment. And I am totally upset. I am seeing like this so many patients. And follow me for health tips. Call me for physiotherapy consultation. And physiotherapists call me for a very good collaboration from around the world. Even if you are having clinic, and I will be very respectful, and I will treat you well, and I will guide you, and I will pay you well. This is Prakash Physiotherapist.